Hey there, and yeah, welcome to our introduction to aerobic and strength training programming. When we cover this, there's just a few terms and ideas that will help set our context for us. And some of them are a little bit like definitions. So when we are using the terms or speaking about fitness benefits, we're really speaking to the improvement of specific individual metrics that we would use for describing aspects of fitness. For example, when we are doing your vertical jump tests in lab, or if we were to test lactate threshold of individuals, those are fitness benefits. Those variables or metrics of measure listed here, again, are very specific for fitness or sport, right? We can think of them increasing the performance or directly related to the performance of a sport activity, right? So when it says sport or activity, you should say physical activity to be more specific. In particular, one that's related to, let's say, a specific game or something. Okay. Now, in not necessarily opposition, but slightly different from that concept is health benefits. So when we're speaking about health benefit, we're really speaking just about the physiological adaptations that occur to reduce the risk of disease. So if we were to speak about cardiovascular disease, which we will, when we exercise, we help decrease the risk of getting some of this cardiovascular disease. Here, for example, blood pressure. So it helps reduce the risk of hypertension, and we'll speak to what that is and how that can affect us adversely. Okay. Now, a lot of physical activity and exercise, even if it's for, say, a performance side of things, typically has both health and fitness benefits. For example, if we do a lot of aerobic activity, that will help our VO2 or our volume of oxygen, and that will have benefits for both sport and for decreased mortality. So mortality is the rate of death or likelihood of death. When you talk about decreasing mortality rates, you talk about decreasing the causes of death and the rates at which they're occurring. Okay. I guess another similar one that we've spoken about before is actually resting heart rate, right? So as we exercise, we decrease our resting heart rates. That's a good indicator of good cardiovascular health. So we get an advantage to both fitness and health through aerobic exercise. Okay. So intensity of exercise and is kind of how difficult the exercise is. I want to speak to that in particular more so on the next slide, but we can also discuss training or the amount of exercise we're doing by saying volume of exercise. What do we mean there? Well, it's how much work or exercise is performed over a certain amount of time or period of time. So with volume of training, if we were to put it in context of, say, like cycling or running over a season, you take the amount of time that each session is done for, you have to consider some of the intensity in there, and then multiply that over the frequency of how often over, say, a week, a month, or a training block, or a training year that you've performed that amount of training. Okay. Health benefits can be less intense, I'm going to start that again. Health benefits require less intensity than performance. So when we're talking about fitness benefits, typically we need a little bit more intensity, but usually for health benefits, you need very moderate or very low amounts of intensity of physical activity. So when we're engaged in certain activities, we can walk, and walking in particular has a very good health benefit for a lot of different reasons. In particular, say you're walking in forests or woods or nature, right? On the opposite end of health benefits and physical activity and exercise, of course, is with this increased intensity of exercise what can happen in particular when you're training for performance or sport is you can have some adverse effects. So again, if you're engaging in physical activity for health benefits, there's often not this negative consequences, but with training you can have overtraining, perhaps injury because of very high intensity in your training, or illness that can occur from becoming run down physiologically speaking. Now, that's not the tiredness you'd feel after a bout of exercise. That would be after a high volume of long, high intense kind of training that you would run into those situations. So in order to frame that, when we start speaking about exercise for fitness, not just for health benefits, although this applies to general health as well, is we have this FIT principle. So frequency, intensity, time, and type. FITT, okay? And this FIT principle, if we look at, say, aerobic, flexibility, muscle endurance, muscle strength, or body composition, we can look at how to prescribe or plan using this principle. Okay, let's talk about aerobic activity just as an example, but you can pause and kind of take a little peek here. This is by no means an exact, detailed representation of how all of these should be done, although Shannon Sweetland has done a good job of giving good guidelines. Again, it depends on the individual and their goals, but generally speaking, this is fairly good guidelines. Okay, so if we're to look just at our aerobic activity for this particular individual, they're training 3 to 5 times a week at 60 to 90% of their maximum heart rate. So if we think of what we know about intensity, this is probably more for performance rather than health. Health would be probably more closer to like 50% of max heart rate, maybe at the very most 80, 75% sort of thing. Okay, engaging in 15 to 60 minutes of continuous physical activity and have kind of a progressive load over that time. And how can we go about this? Well, the type of activity includes anything with large muscle groups, continuous rhythmic movement that we can continually do. So for example, running, cycling, swimming, some of my favorite sports. And so that's how the FIT principle works. Now we'll get into more specific guidelines for aerobic and muscular strength in particular, and we'll speak to what sort of metabolic pathways they encourage in a later lecture.